And then I can also do work on the piriformis area with my fingers, and that's where we do like the dragging back towards us, like this. And I like to really do a good job around the greater trochanter, so getting right next to it and doing some deeper compressions. What number?
It's like the 6 over.
Okay. So I can really do all kinds of compressions all around the greater trochanter, just really close to it, and then up away from it through this whole arc. And basically the end, or the more inferior part of the arc, is going to end here at the gluteal tuberosity. And that's right on the femur. And it's like a hardened pad of tissue that can be sensitive. What number?
Get 3.
3. Make sure I'm on the epicenter. Now.
4.
I'm holding compressions there. And I could continue down the hamstrings if that's the way the session was going. So I could do some compressions right next to the ischial tuberosity. Hang out there for a while, do different angles. So I could compress here, I can compress there, I can compress there. A lot of different dimensions that I could work on. I feel like right there connects me the best. That angle, does that feel the most? Does that feel pretty connected? And releasing at the attachment sites can release the whole muscle, because there's a lot of sensing organs in the muscle and connective tissue at the attachment sites that are regulating the muscle's overall tension. So if you don't have a lot of time to do nice long strokes down the legs, down all the numerous leg muscles we have, working on these attachment sites can still create a release that is beyond just the compression area. And I'll come out with a nice circle. And I like to use circles to move, so I don't even disconnect from the skin. I'll just circle around and try to find where there's that braille-like raised texture. She has something right there, it feels like. Yeah? You can hang out there for a while. After that releases, I can come out, I can wiggle, move down the leg a little bit more, find a new spot. When I'm done with this area, I can move down, I can work more on the calves, doing compressions on the calf belly. So if I circle around lightly, I can feel like right about there. Little button, little trigger point button. So I can also do strokes along the Achilles. I can do strokes to separate both heads of the gastrocnemius. So either down the center to form like a, to part the C's basically, or you can go on each head up to the femur. Have we done soleus in this class? We haven't even done the hamstring or anything. Well, you're getting a little preview. I'll show you soleus too. So soleus is underneath the gastroc, and your soleus is your most powerful plantar flexor. So it's the most powerful toe pointer. And a lot of people think the gastroc is the most powerful, but it's actually your deep soleus, which doesn't cross the knee joint. It attaches just to your tibia and fibula, from there down to your Achilles. So to access it, because it's deep, we'll have to do the same thing we did for the rectus femoris and vastus intermedius. So remember how we moved it out of the way and then we compressed down? Same thing here. So here's her gastroc right here in between my fingers and thumb right there. So you can see I can move it around. So I can move it medially, and then with my thumbs I can compress down into the soleus. The soleus is called the second heart in the trigger point book. I haven't talked about that yet in this class? No? So the soleus, when you're walking, the soleus and gastroc, and we can look at it in our books, it looks a lot like a heart. And the contraction and release creates a pumping action in your leg, which helps to force blood back up your body. And you may have been able to feel, like when you're sitting on a plane or a really long car ride where your feet haven't been able to move, how your legs start to feel a little swollen or stiff. You ever gotten that? Well, part of that is the circulation that's getting stagnant in the leg. All right, so I can compress down with thumbs or I can compress down with fingers. But you can see, here's the gastroc. Soleus is all along this edge here, and I'm compressing it down into the bone. I can even do strokes on the soleus too. Gastroc out of the way, I could do a nice stroke on the lateral side, and I could stand over here, and I could do the same thing. Medial soleus, using my thumbs, moving the gastroc out of the way. Like right here on a lot of people, they're really tender. She has a knot right in here, right in the soleus. Is that sore? A little bit. So working all along this region here can really release a lot of tension. And I'll demo it again. We'll talk further about it when we do it in class. Okay, so I'll just quickly go back to the QL. Okay, so the quadratus lumborum is connecting your iliac crest, your lumbar vertebrae, and your 12th rib all together. So when it contracts, it's going to hike the hip, it's going to lift the hip up, or it's going to pull the upper body into a side bend. So when you see somebody that has a hip that's higher, their QL is often the culprit in creating at least a part of that. So erector spinae, really close to the spine. The quadratus lumborum are lateral of the erector spinae and deep. So like I mentioned before, it's like a staircase. So the erector spinae is the first step, and the QL is the second, right there. And it often feels harder. It has a different texture than the erector spinae usually. What number is that?
4 or 5.
4 or 5. And just keep in mind, you don't need a lot of pressure here. It's better just to have a consistent pressure that doesn't set them, set them over the 7, doesn't set them off as far as the pain goes, and just hold a little bit longer. Just my touch here will signal her body to release. So it doesn't take a whole bunch of pressure to initiate that. Several different angles I can take too. I'm kind of like right in the middle right now. I could do a compression just underneath the 12th rib, not on it, but just underneath of it. So this is the most superior I would go on the QL. And then there's the belly, and then there's the iliac crest attachment. So I can hold a compression there, and I could do all this with my elbow too. Do a nice compression going that way, directly medial. And I can also stay with my vector, my Dantian facing more of her hip here, and helping to open up the lower back. A little traction. Just like that. And you can also do strokes. Number 6. So I'm lateral of the erector spinae, and I'm angling into the spine a little bit to capture the QL. How's it feel? Good. Make sure I take it all the way to the ilium. And I can finish with palm and fingers over the sacrum. Okay. Oh, I didn't show you one more thing before you flip over. So when the lower back is too tight for skin rolling, We do this cross pull.